Welcome to the second season of the Dr. Ramsey Show. Our intention is to deliver educational content and useful information on holistic health and our clinic, Revitalize Functional Medicine. To stay up to date with our weekly episodes, be sure to subscribe to our channel. Enjoy the show.
Hi, welcome back to season 2 of the Dr. Ramsey Show. I hope you've had a great summer. We've taken the summer off. What a year this has been for all of us. And, in Arizona, things are definitely opening up. It's nothing like last year. I'm so grateful that we have our freedom back. And, part of that I wanted to share is that for us, treating COVID last year was simple. Three IVs, patients were well. This variant we're seeing is very different. We're still treating it a lot, but it's different, and it shouldn't be. And the reason it shouldn't be is because in nature, viruses mutate and get weaker. Like, that's nature. If you study immunology, if you study virology, that's true. When you have this type of a virus that has a animal source, it does get stronger or different. I'm not gonna say stronger, it gets different. And what I mean by that is this year treating, we've had a little, not difficulty, but it's required more effort on our part and on the patient's part because there seems to have this like bacterial portion that comes in with it. I'm not sure what that is, but we still are treating COVID. This variant's a little bit different and we're having great success as we did the first season. So please, tell your friends. One of my friends last night said, all of us need to know if we get sick, where to go. We have to have a game plan. And I want you to know that you can come here. And we're expanding our office. We are remodeling this month. So it will not interfere with patient care at all. But we're adding space onto our office because we've run out, quite frankly. Yeah, so the biggest thing is just have a plan for yourself if you get sick and know that we treat it naturally. Do I treat with ivermectin if I need to? Yes. Do I give antibiotics if I need to? Of course. But we don't have to very much. And my belief always has been natural immunity is much stronger than chemical immunity. And if we get it again, we already have some antibodies to it. It's not going to be as bad. So this season, we have a great shows lined up for you. I'm going to have a pharmacist, a compounding pharmacist, come on and share her view of hormone replacement therapy and the FDA and all of that. I have Dr. Minkoff joining us. He is the physician who has a very successful cancer clinic in Florida that uses the Perfect Amino, our top seller in our practice. He's going to talk all about that with you. I'm going to have my mentor, Dr. Neil Rouzier, on. I haven't asked him yet, but I know he'll want to come on with us. I have some more patients that are going to share their experiences with NAD, with COVID, with hormones. And then Rosemary Siciliano is going to join us. She's my colon hydrotherapist, and we're going to talk about death begins in the colon. So lots of really great shows are coming up. We are working with, as a group, a breath expert. His name is Woody, or Creston Woods. He has his own practice teaching people how to breathe. What's really interesting about it is if you think about babies, when you watch them in their crib, their bellies just breathe. You don't see their chest. They breathe their bellies because they're very relaxed. As we age and get stressed, we start breathing into our shoulders. And so he teaches how important the breath is for everyday work, for all of our health, and how we can get more out of our days by just breathing properly. So he's going to be one of our guests as well. Yes, so this month we will be expanding our clinic for more space that we need. It will not interrupt patient care, but will be happening with this September or October. It will be complete and it will be beautiful. And we all look forward to having more space working together here. So we've had a third nurse join our team. I'm sure we're going to be needing more nurses because the call for our nurses is very, very high right now. And we're actually looking at, we haven't created it, but working like with a hotel across the street for our NAD patients, our COVID patients, just so they have a place to go where they're comfortable instead of having to be in the different offices here until we remodel. So if nurses don't want to get vaccinated, they have a place to work here because we don't require the vaccine to work with us. So we have this new machine, and it's a body contouring machine. It's called Evolve by InMode. We've had it for a few months. It does 3 things. It's not a weight loss machine. It's a body contouring machine. So it tones muscle, it trims fat, and it tightens skin. And so like, as myself, I've been heavier and lighter, had kids and all, so skin stretches out. And so it doesn't really bounce back as we age. And so the tightening part is specifically what I'm using it for, but patients are using it for all 3. And it's really been a great success. And the last thing I wanted to share with you is I am so grateful to have Shaylee back with us. You all remember Shaylee. She was here with us for about a year. Then she got transferred. Her husband got transferred to the East Coast. And then they moved back here not too long ago. And now she's running the entire office. She was my assistant, for those of you who worked through her. And then we needed her to run the entire office. So she's the director of operations now. And we are all so happy to have her back. She runs the ship so smoothly, and our patients are very happy now because there was a little chaos there for a while. It's all smoothed out. So thank you for listening. I'm so happy to be back with you this season, and we will see you next week. Have a great rest of your day. Bye-bye.